What we're focusing on a topic that you all last year asked for. You said in your responses to NEUAC, you said, I want to learn more about what different states are doing to serve clients more effectively and what they're doing to help their staff be able to do an effective job. Because how many of you are intake staff workers or managers of intake staff workers here? And how easy is your job to do? How many think your job is really easy? How many think your job is kind of challenging? How many think you wish you had a whole lot more time and resources to get the job done right? Well, so what we're talking about today, one thing that we're talking about today is how, and people are asking how to better serve clients, but another thing we're talking about is how to help intake staff workers have all the resources they need to do the job that they feel is best. Today, we're going to hear an introduction to LIHEAP from Melissa Torgerson from VER. And then we're going to have Brian Worrell from the Pennsylvania Department of Human Services, Lori Walking Eagle from Rosebud Sioux Tribe, Bobby Davis from Wisconsin HEAP program, and Teresa Cullen from the Colorado Department of Human Services program to tell you about what they're doing on each of these topics. So after this session, participants will better understand some of the basic rules, guidelines, and considerations every grantee must account for when designing and delivering LIHEAP, different ways that various states, tribes, and territories interpret federal statute and state laws when implementing LIHEAP. The topics: Program Basics by Melissa Torgerson from VER, Serving Clients and Empowering Staff from Brian, Lori, Bobby Davis, and Teresa Cullen. If you have questions, we're not going to take questions during the session. If you have questions, what you need to do is you need to go to the specific, you get into your Wahoo-va app, go to the specific session, and then there's a Q&A button. And Kevin is going to be monitoring the Q&A. And if there's a question that he knows can get answered right away, we'll interrupt the speaker and ask it. Otherwise, we'll address these questions at the end of the session. And so now we're going to start with Melissa, who's going to go through LIHEAP program basics. Oops.
Good morning. So some of this is going to be a review for some of you who were in the session yesterday. So I should probably maybe do a quiz, but I won't because it's too early and the coffee hasn't kicked in yet. But in this part of the section, I'm just going to talk a little bit about LIHEAP assurances, what they are, other federal statutory rules and guidelines, state statutes and rules, and factors that you need to think about when you're planning and designing your program for your state, tribe, or territory. So for those of you who weren't in the session, and a refresher for those who were yesterday, the federal statute is what guides us as we design and deliver LIHEAP. And every September, you all do a model plan that says this is how we're going to spend LIHEAP money in our state. And at the very beginning of that plan, or end, depending on where it is, you have to actually, your governor or someone, his or her designee, has to sign off on these 16 assurances, assuring the federal government that you will abide by the statute and these fence post rules that we're going to talk about. Let me give you some examples for those of you who were here yesterday. I'm not going to make you holler them out for candy again because you ate all the candy. But some examples, these 16 assurances cover things like, here is the income eligibility for the people who want to apply. You must do outreach. Here's how you have to target your benefits. Who should get the highest benefits in this program? Here's who you should be paying and the kinds of rules you need to have in order to pay vendors or home energy suppliers directly. And you must treat owners and renters equitably. Those are just some examples of the kinds of rules that these 16 assurances lay out for people as they're designing a program. Now, the reason we want to talk about this isn't because we want you to walk away today with an idea of what all 16 insurances are. You need to know, the bones of them. But what we want you to understand is that this is a block grant. And you may hear that term thrown around a lot, but what that means is that the rules are your outer bounds. We call them fence posts. So I don't know how many of you work with horses. I know Lisa does in the front row. But when you think about like a corral, for example, we look at the fence posts, but more importantly, it's a wide open space that you have to design your program within those fence posts. And that's why we spend so much time talking about insurances, because when you know what your outer bounds are, you can move freely within them and even push up against them, right? So the federal statute gives you boundaries, but you as a state, tribe, or territory have a great deal of flexibility when you're designing your program, which is important because, as we know, even in single states, tribes, territories, there are different needs, right, from one county even to the next. So it's important you're designing a program that meets your unique needs. Now, that's not the only thing that you need to take into consideration. Actually, let me take a step back. State laws and rules. So if you think that the federal government is strict, you should look at your own states, tribes, and territories, because chances are they have rules and laws about how you must administer LIHEAP that are more strict than the federal ones. And for those of you who are new to this program, one of the biggest takeaways from this conference, I hope, is that you'll go back and actually look at what those rules and laws are. What are the things that your state has, the additional limitations that your state has placed on you? And if they're not working for you, what steps are needed to fix them or tweak them? For some of you, that means legislative action. For some of you, it's going through an advisory committee. For some of you, it's internal and doesn't actually take a whole lot. So the other things you need to take into consideration, and to me, these are the most important things. Well, I mean, the federal rules are important if you don't want to get in trouble, but these are also important. Client need, other available energy assistance or weatherization. Many of you have really big utility programs in your state to supplement LIHEAP, and that's important when you're planning your LIHEAP program to think about people's overall benefit or access to resources. Climate, and that's in some of your states that's changing. How many of you are from Florida? Anybody in here? Florida contingent over there. Woo, woo. I just read a news article that like Miami is having this enormous heat, like big heat wave, right? And it's not even June. And so things are changing. How can you make sure LIHEAP changes along with it? Fuel type and geography. I just visited Hawaii and they have 11 climate zones. And so any of you who have been to Hawaii know the challenge it must be to deliver a program like that. But I've started here today, customer and worker experience, because LIHEAP doesn't exist without all of you who raised your hands today. It doesn't exist really without any of us. And so it's very important that the customers have a good experience and that the worker has a good experience. I told a story a while back that on my 20th wedding anniversary, which was 6 years ago now, my husband was in a car accident. We were eating pho for dinner in our bed. I know that sounds weird. Well, the kids were at youth group, and he had to go pick up all the kids from youth group. And on the way there, he was hit by a utility truck. Just kidding. And so I remember, we had to go get him. We had to go find the kids. We had to get to the hospital. All of this different stuff. And I kept my cool. I totally kept my cool through the whole thing. And then when I got home, we had left our pho on our bedside tables because we were in such a hurry to get out. And my German Shepherd ate our soup. And I lost it. I just lost it. I didn't lose it at the hospital. I didn't lose it at the accident site. I lost it because my soup was eaten by my German Shepherd. And it wasn't because of the soup. It was because I was at the end of my rope. I had hit my limit. And so transactions are really important. And we say this a lot. We talk a lot. You'll hear it a lot. Outcomes, performance management. But the process is also really important to maintain the dignity of the clients that we serve and to make sure that they leave not more frustrated than when they walked in, right? And so that's at the core of this presentation. Now, customer experience, the statute, especially in insurance, it doesn't say anything about customers must leave happy. right? I wish it did, but it doesn't. But it's woven throughout all the different assurances. So for example, assurance 3 requires that we coordinate LIHEAP with other services so people aren't having to go through 12 different doors to get the help that they need. Timely processing of benefits. We've all heard stories where someone applied for benefits and they sit at home just waiting on pins and needles to find out when it's going to hit their bill. Protections for LIHEAP customers, equitable treatment of different groups like renters and owners, and categorically eligible and income eligible households, fair hearing processes, and timely crisis intervention and geographic accessibility. Now, I don't have a whole lot of really nice things to, big things to say or citations to give you, but the bottom line is that if we're going to do a good job by our customers, we have to do a good job by our workers, period. That's all there is to it. We need to provide them the resources that they need to do their job, as well as feel safe and valued. And although we won't talk about it today, we also need to do everything in our power to make sure they aren't eligible for the program that they're delivering. So I'm going to turn it over to an awesome person, Teresa. And each of these folks, as David said, are going to talk about both things they've done to make the customer experience better. So how can we make that transaction go more smoothly, as well as things they've done for their workers.
Okay, in Colorado, when I came in, I had been working as a manager in the county level. When I came in as the state program manager, I knew that what we were doing was denying a lot of people for not getting their verifications in timely. And all of our LIHEAP rules sit in our state statute, right? So it's always a nice long to-do to get your rules changed, but I set out to look at what we were doing that didn't need to be happening, that we could foster the eligibility process and help it move it along, not only for our clients, because we got to get those barriers out of the way, but if it's easier for the clients, it's going to be easier for our eligibility technicians as well. So our previous rule used to read that all verification needed for case files had to be submitted in writing. You know, and you sit back and you slap yourself on the top of the head and say, all I need is this one thing. Why can't I pick up the telephone, get the information I need, and move this to the done pile and make the done pile much bigger than the waiting to get done pile, right? So now we changed all of the rules, but one about being in writing, that it could also be by collateral contact, that you could just pick up that phone and ask somebody, if it's a utility vendor, but they're not one of the LIHEAP vendors, can you tell me, is there an account here at this address? Yes, yes. And the heat source is propane? Great, that's all I need to know. And the account's name is in where? Boom, it moves over to the done pile. So it simplifies the process to expedite the eligibility determination process, and it reduces running around for our clients to get us in writing. Mind you, it must be in writing. Like, no, it doesn't need to be in writing. And so it breaks down barriers, and it enables our technicians to be able to move through applications quicker.
Teresa, before you move on, we have a question. What is considered
in Colorado, timely is 30 days for a non-emergency application, and anyone facing disconnection or already shut off or out of a bulk fuel or facing that is 14 days. And obviously, if they're already off, we got to get this done. We got to get them turned back on. Thank you. Anything else? Okay. And there was another very high reason of applications that were being denied for not getting their stuff in, right? And it's like, okay, make them run here, 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 and here. How can we make this not so hard on them? So I had been working at the county level in other programs as well as LIHEAP. And I thought to myself, now, if it's an adult financial application and they're denied for not getting their stuff in, if the client gets their stuff in, then they just go ahead and reopen that application within a certain time frame. Same with SNAP, same with TANF. And I'm like, why don't we do that? Doesn't that make a whole lot of sense? And so seeing such a high volume of denials, we changed the statute, the rule, that if we denied somebody for failing to get their verifications in, and our program is what we call point in time, that eligibility is based on the day we get that application in the office. If they manage to get us everything in within a certain time frame, our application period shuts down April 30th, right? That we then can reopen that application up until June 15th. At the very end of the heating season, as things slow down, we also have an outreach incentive program. So we give our counties and contractors money to go focus on those people in their territories, get the needed verification so we can get them enrolled. So it really helped increase our enrollment in the program, not just the applications. I was more concerned about the enrollment, right? Very concerned about the applications too. I shouldn't make it sound like I don't care if you apply. But to turn that around, and the benefits to the eligibility technicians is that, and to the clients, is they don't have to start over again. I don't need another application. I already have one. All I need is that little bit of verification. Wham, reopen, done, move on. Clients barriers were reduced. Eligibility technicians aren't sitting on another 500 applications because we were stupid and made the client start over again. So I think that it's been very successful in Colorado. And now, oh, we have another one. Oh, yes. I thought I got to turn the mic back over to somebody else. No. Another thing we do in Colorado is that with our 4 bigger regulated utilities, they give us access to their customer portal. And what this does is it gives us access to a whole lot of information. One of the verification needs in Colorado is that you have to verify that you're vulnerable to high rising heat costs. So we need to see your utility bill, your type of usage, see the service address with your name on there. Having access to the vendor portals, one, it eliminates the need for the applicant to turn their heating bill. If we don't have it, we just log into that portal and get the verification we need, print it out, put it with our case file, done. And it also eliminates the need for a client to go run and get another piece of paper for us because we think that piece of paper is very important. Now, the verification is very important to the integrity of the program, but you have to start thinking about other ways that you can be accessing your verifications that you need to enable an easier application process for those that are applying for our program. The goal is you put an application in, how can I get you enrolled? Not how can I approve or deny this and get it off my desk. Our belief in Colorado is how the heck can we get you enrolled, and what's the easiest way within the fence posts to make that happen? We're going to skip the questions for now unless there's anything.
We do have one specific to Colorado. In Colorado, does the state process LIHEAP in-house or do CAAs?
So in Colorado, we're a state supervised, county administered, county government administered program. There were we have a lot of counties in Colorado, 64. And one of the rules used to read, if you want to subcontract out, the county want to subcontract out your program, you can, because when you have to start a program up, ramp it up, into winter comes, spring, summer, ramp it down, then hire these masses of people back on again, didn't make a lot of sense for counties, especially our smaller ones without a lot of resources. So we have 64 counties. We have one contractor in there in the room. They do amazing work, Goodwill, Colorado, and they process, 58 counties out of 64? 55. The rest, the counties still maintain the program in their counties and they self-administer at the county level. So we don't use like HAP agencies. We've got the Goodwill that does the majority of the applications. They're amazing. Beginning of the heating season, they've got 70,000 applications in 30 days to get through them all. So anything that we can do to ease their workload and make our client experience better is what we strive for. Okay, I'm done. And now we have Brian Worrell from the great state of Pennsylvania. Go for it, Brian.
Thank you, Teresa. I'm actually good. I'm not a big mic holder. I like to just put it here and talk. So, as Teresa said, I am Brian Worrell from the state of Pennsylvania, the Department of Human Services, and I am going to be talking specifically about two things that we do in Pennsylvania. One that really helps our clients, and that's our utility file transfer program, or UFT for short. Obviously, everybody around here, I'm sure, knows state government. We all love our acronyms. Like most states, we have our winter moratorium in Pennsylvania. Ours runs from December 1st until March 31st each year. This is required by our Public Utility Commission, as I'm sure it is in pretty much all of the other states. During this period, from December 1st until January 31st, we do not allow any households to that use a regulated utility to get a crisis benefit because they are not in danger of a shutoff. Then on February 1st, all of our regulated utilities can start to actually send out shutoff notices, and so households can come in and request crisis benefits. What we have implemented is this UFT program to simplify the process for those households. If a utility received LIHEAP within the current season earlier in the year, so that could be the LIHEAP cash benefit at any point, or if they got a crisis benefit sometime in November 1st to November 30th when they are still doing shutoffs. And then coming into that moratorium after February 1st, if the utility can identify that that household is in danger of being shut off once the moratorium ends, the utility can actually submit the request on behalf of the household to Pennsylvania for crisis benefits, which takes the burden off of the household to know that they are in this crisis shutoff situation and contact us and request it. We do have certain requirements around it. Am I getting ahead of myself? The only other key thing on here is we consider a household categorically eligible for the rest of the LIHEAP season once they've gotten a LIHEAP benefit earlier in the year. So, they get a LIHEAP cash benefit November 1st. We consider them eligible for LIHEAP crisis throughout the rest of the season. They can only get one cash benefit, but multiple crisis up until they hit our max. And so, as you can see here, there are two key requirements. The household had to have previously gotten a LIHEAP benefit in the current season to that utility, and the utility must contact the household to collect their consent before officially submitting the request. This is a very key item that we do stress for our utilities. We actually have a UFT agreement that we send out to all of our regulated utilities that they must complete and sign, much like a vendor agreement, before we will allow them to participate in our UFT. It's a very pared down version of a vendor agreement. All of the vendor agreement terms and conditions still apply. These are just a few extra conditions that we add in specific to the UFT program, such as agreeing to maintain service until the end of the moratorium, only submitting one UFT request on behalf of the household to prevent utilities from saying, oh, they're $25 behind here, give us $25 now and then give us $25 next month, and so on and so forth. So that they have to have a certain amount to be able to submit the UFT request. Another key one is that they have to be able to securely transfer the files to us. Now we use secure email in Pennsylvania when we're emailing with our regulated utilities. We test that every year to make sure that there's no issues with IP addresses or anything like that. We've also used password protected files in the past as a way to just make sure that, obviously, because we are passing some client information back and forth, we want to make sure that we treat it securely. And so we define that within our agreement. Once we have the agreement, the utility can fill out, basically, it's a spreadsheet. That's all it is, an Excel spreadsheet that has about 10 or 15 fields on it. And they basically fill in the basic information that we need to be able to process the crisis benefit. Payment name and address, household size, the account number, and how much is needed to resolve that crisis. We pull that information in at our county assistance offices. They can quickly check to see how much is available for the household and process the crisis. They fill in a results field and send it back to the utility, and the utility cancels the shutoff, clears out the debt, and enters it into our promise system, which then pays them officially. So it's a nice low tech way to help our clients, because, like I said, it's just email, secure email, and Excel. I mean, that's really all it takes. It's not a whole lot of heavy load. We do limit the number of households that they can submit at a time to 500, so that way, our caseworkers do not get overwhelmed in terms of processing those benefits. So, we get a file of 500, work our way through that in a week or two, send it back, get another list of 500, and so on and so forth.
Brian, before we move on to the next
Sorry.
Question: was this moratorium born out of COVID, or did you have to provide it?
It's been in place in Pennsylvania for a long time, since well before I came into my position, which was in 2017. I think it's been in place for, I want to say, like at least 10 years in Pennsylvania, 10 to 15. It was definitely a pre-COVID. 30 years. David is very well aware of these types of rules, and he's telling me 30 years. So that was well before I even started working for the state. So. You mean the No, it's, well, a customer can call us and request the crisis on their own, but in this case for the UFT, it's the utility that reaches out to the household and says, hey, we know you're in shutoff and we know you got LIHEAP you had your earlier LIHEAP benefit come to us earlier this year. Do you want us to submit a crisis request on your behalf so that you don't have to do that? And as long as they collect a yes from the customer, they can send it in to us. Yep. And I will say, we don't have any specific rules around how they collect that consent. It can be, email, phone call, letter, however they can get in contact with them, as long as they collect the consent and can, send us verification that, hey, we made a note on their case that we collected their consent on this date, so that we can track that if we ever need to.
Another question: does Pennsylvania consider all disconnects crisis, or is there additional criteria?
We consider any potential shutoff or actual shutoff a crisis.
And then another one: do customers have to pay on their utility bills during the moratorium? And if not, do arrearages creep up? How is that addressed?
They do still get a monthly bill during the moratorium. They are expected to pay that. However, if they do not, that arrearage just builds up, and then once we hit February 1st, if they've hit a certain level, most utilities in Pennsylvania use around a $200 threshold before they will start a shutoff process. So that's sort of the low watermark. Is that all? Okay. And so in terms of how do we help caseworkers a little bit, this one we're going to get real high tech on you. We do real-time eligibility for our LIHEAP cash program in certain instances. We have an online application portal, Compass, stands for the Commonwealth of Pennsylvania Application for Social Services, if I'm getting my acronym right. And it's actually, we've had Compass for about 22, 23 years now. We added LIHEAP into it around 10 to 15 years ago. And so, you know, this allows our recipients to apply for all of our benefits through this online portal. In Pennsylvania, we run an integrated eligibility system. So our county assistance offices are doing TANF, they're doing SNAP, they're doing medical assistance, and they're doing LIHEAP, all in the same eligibility system. And that's what sort of has afforded us the ability to do this real-time eligibility process, because, you know, we've been able to build a lot of the online information for other programs and then fold LIHEAP into that after the fact. And so we do real-time eligibility in Pennsylvania. So when somebody submits a LIHEAP application for cash benefits in our online portal, they have to go through a series of gate posts. And I give a breakdown on the next slide. We divide the gate posts into two items. There's critical and non-critical. If they pass all the critical gate posts, that results in what we call auto application registering. And what that means is that's what our clerical staff and our CAOs do, where they're basically just taking the application, entering in the demographic information, and then assigning it to a caseworker to do the actual eligibility review, pending verification, documentation, all of that stuff. And so if they pass the critical gate posts, the system will automatically import the application into our eligibility system and register all that demographic information and front load it for our caseworker staff to help them speed along the review and pending process and also make it easier for them. Then we have a group of non-critical gate posts where if they pass all of those in addition to the critical gate posts, our online portal will do the entire cash eligibility determination right then and there and sync it up with our eligibility system and generate the payment and capture all of the necessary information. And obviously these last two bullet points here show pretty obvious benefits. It reduces the time a household has to wait for their eligibility determination. They can get it within seconds. And it also reduces the number of applications that our caseworker staff actually have to process. You know, and like I said, everything is still stored, so we can still, you know, for a ACF monitoring visit or our internal state auditors, everything is still there like it is a normal application. Like we have all what we use for verification under the RTE and everything. So, you know, we cover our basis. It's not like there's anything missing there. So we have 8 critical gate posts. Like I said, we try to keep this number a little lower so that we can get more applications registered. And then we have another 11 non-critical gate posts. So we have 19 total gate posts, which I know sounds like a lot and is a lot, but some of these gate posts are pretty straightforward items like, has this person ever received LIHEAP before? You know, is the person still using the same utility and account number from the last LIHEAP season when we verified it? Things like that. And we are adding two of these gate posts are new this year that we're adding to help, you know, just continue to streamline and improve the system. And so the other thing that is nice about Compass is that it does allow for electronic notices if a household signs up for that. So that way, you know, they get an email saying, hey, you have a notice in Compass, please log in, and you can view it, and they can just log in and see the notice. And we also, it's not on here, but we also allow them to upload their documentation through Compass and through our mobile app. They can just take a photo and upload the documentation that way. So all of that ties in together. But like I said, you know, we are very fortunate in Pennsylvania on that front because we do have this integrated system that has allowed us to stand up a lot of these more high-tech solutions.
We have a few questions for you. One is if they only pass almost all of the 19 gate posts, but not all 19, say 17 or 18, are you able to make an exception?
No, this is all entirely electronic and systematic. So it goes through the 8 critical gate posts first, and then it starts going through the non-critical. And so once it gets through, it's essentially like, hey, if you get past 8, you're at least getting to the auto registered, but if you get through all 19, then you get the auto eligible.
Do you get any pushback from vendors, or are they willing to submit for crisis as often as
Uh, our vendors love, I assume this is about our UFT. Our vendors love the UFT in Pennsylvania. There have been times where we have delayed the start of UFT, or we've been unsure if we wanted to run it that year just because of, like, hey, say there isn't a budget passed and you're waiting on funding. There are always conversations around that, but they have always very much supported it, and they always ask about it. Hey, are you doing the UFT this year? So it's very popular. All of our utilities love it. And again, like I said, it helps the households, but it does help the utilities too. I mean, they very much appreciate it because they make sure that those households know the availability, get that consent, and get it in, and then the utilities get their money. So which is not the right way to say that, I realize, as I say it, but I mean, like I said, it's very, very popular with the utilities.
no further questions?
All right, then I'm going to turn it over to Lori Walking Eagle from the Rosebud Sioux Tribe.
And in my part of the presentation, we do the educating, informing, and assisting of clients. When we try to work with our individuals within our reservation, I brought up one of the pieces where I educate elders to pay their electricity bill via the phone with their card, because we constantly remind them that this is a supplemental program. We have a majority of our elders or people who get their Social Security or any type of their monthly income on a card, and then they don't pay their part of the electricity bill, which then causes a crisis, which then causes a disconnect. So me or my staff, we go out to meet with our families, particularly this one elder whose bills always went up to $700, $800, $900. We have an electricity company that allows our individuals to go 90 days before they disconnect. We have one company that goes 30 days before they disconnect. This particular elder, so we have a population of people who are afraid of leaving messages on a phone, afraid of using a computer. I just learned to text about 2 years ago, I'm not lying. So it took some time for me to sit down with this particular elder, get on the phone, have her read her card, and then let her verify that her portion of the bill was paid. So that's one of the things that we do to go out and work with our individuals. We have staff who go out and educate our families on the light bills, the due dates. And I know this sounds really Flintstone-ish, but we are in a part of the state of South Dakota where we're very rural. We have, communities of maybe 200 people, no stores, no gas stations. We still have dirt roads. We barely got signs. We barely got 911 access, probably within the past 7 to 10 years. Our E911s, they still couldn't really map us out. So it is very rural, the place that I'm coming from. We don't have the luxury of, going to the nearest Walgreens, Walmart, taking a taxi. When we have an individual like an elder from our Spring Creek community, which is 14 miles from our office and doesn't have transportation, when their monthly income comes in, by the time they get to go grocery shopping, they've already spent a majority of it paying for a person to take them their gas and their food. So it is very rural, and it is very when I talk about us having to go out and educate. Our staff goes out to the communities. We go out to the people. We know which ones are our problem children. We know which communities we have to go to consistently to help get the information. So we are making those phone calls. We do use our phones to take pictures of their tribal IDs or their light bills. We do call for them. So we do what we can to get them certified. And I think one of the questions, what is a crisis? I think when we have a crisis, we try to answer that crisis within 48 to 72 hours. But I'd like you guys to give a hand to my staff, Miranda Romero and Sharon Swift, my intake specialist and my data consolidation. If we didn't develop as a team, if I didn't have the mental health, the mental health days, if we didn't have the retreats, we would be very burnt out because of the type of clientele. So we have roughly 2,300 households on our reservation. We deal with 1,113 to 1,200, which is over half of our housing. Now, we don't get the real nice houses that have the structured windows, the great doors, thick insulation. Our population, like my mom, still lives in a transitional unit. A transitional unit is what was given to us pre-reservation when they were moving us on them. They were just very thin housing units placed not even on foundations. We have trailer houses. We have SU 400s. We do have some HUD housing, some SWA units. But those are the housing that we get on our reservation. It's hard for people to want to come and build or even do mortgages because we are a sovereign nation. And if someone defaults on a mortgage, they don't have the right to come and get their house back. Because we are a sovereign nation, we don't have any laws that lets the lenders come in. So we have very few people who want to come lend us money to build housing units. So when I got off base, but we do have staff that go out and educate on the light bill due dates because people do, their basic needs for that day is a priority for them. How am I going to feed my children? What am I going to do to get this other bill paid? So when we say you need to think about the due date that's coming up next month, oh yeah, I will. Well, they forget, and we have to come in because there's now a crisis because they're going to get disconnected. We talk about the late fees. So like Cherry Todd, and we worked with them, by the time they allow us to go 30 days, so if you have, let's say, $100 light bill, on the 15th, they'll add a $5 late fee. On the 25th, they would have added a $10 late fee. On the following 5th, or $20. On the following 5th, it would have been another $20. By the time they disconnected you, that was another $20. So that was a total of $65 before on the day you got disconnected. And when you got disconnected, you needed $50 more to get reconnected. So our TUC commission, as well as myself, we met with the manager. They took off $120 late fee. So we go out, we have to educate our individuals about if you don't pay your portion of the bill, and just recently, and I'm not trying to make our tribe sound like, because we have a lot of intelligent people. In fact, they're honoring my sister for her. She got Superintendent Rookie of the Year in South Dakota. They're honoring her today on the council. So we have a lot of educated people, but we do have a lot of individuals that, because of the basic needs that they cannot meet, they do not think about, okay, so I am certified for $150 for LIHEAP for this month. My bill is $200. So LIHEAP's going to pay $150. That means I owe $50. I had to walk an individual through this just about 2 weeks ago to let them know, get out your light bill. Deduct it from what you're eligible for. What is left is what you are responsible for. We do have to go back to the 1, 2, 3s because we do have such a high need there. I mean, we have 85% unemployment. I did a meth survey back in 2016. As a side note, I asked what type of education level they had. A majority, I think 78% had an 8th grade education. So we do have staff that go out and educate the families. We have staff that go out into the communities with applications and assist with obtaining the applications. Like I said, we use our cell phones to take the pictures of what we need to take, and then we go back, we email them to ourselves, and we get what we can. My intake specialist, Sharon or Miranda, will go and call DSS, the utility company, our office where we can, our enrollment office, or even our E911 office to get the documentation. We do try to make it a little easier for our clients to get the information that we need to have completed. Another thing that I have done was empowered my staff through training. We went through a self-defense course in January provided by our adult correction facilities, only because our 20 communities that are on the reservation that span 4 counties in the south central part of South Dakota are very rural. Out in our Milks Camp community, which is about 180 miles, no, about 100 miles away one way, they have a running joke that if you call the police department, you can hide the body, hide all the evidence even before the police get there. In Spring Creek and Upper Cutmeat, Norris, we have all we have are housing units in our community buildings there. And we've had people who have stalked my staff, who have gone in and thrown apples, thrown things at my staff, hollered at my staff, threatened my staff. So we've done some self-defense. We also do de-escalation. What do? You don't mirror that person. You sit down so that they're above you. You know, you lower your voice, you use their name. Those are the types of things that we treat. I train my staff because we do have people coming demanding, thinking it's an entitlement. They're going to call council, they're going to call the president. And they come in very angry, and it's not all, it's probably maybe 3%, 5% of the individuals that we work with. But what has heightened that and the need for us to do the self-defense is the meth use. We have meth that is tainted with fentanyl. So when we have people tweaking and they come into our offices, their energy and their strength is heightened. So we have to be very careful. And when we're out in the communities and they come in, they're slamming or they're tweaking because they think that they're not being treated properly. It's in their mind. And those are the types of things that we have to do. We're very hands-on. We're very near our people. We're in the communities. Staff are trained to document all calls, mail and fax logs so that we can show, here's what we received, this is what was talked about, because the staff that we have, we're all intertrained so that we can all do one another's job if the person's not there. The receipt signed by families when the weatherization is complete. So when we have our weatherization / repair person go out, they're able to fix, the worst of the window, the door, whatever. They have a receipt that the person signed saying that they did a good job and they're pleased with that.
We have one question. Are the utilities on the reservation owned / administered by the tribe?
No, we are actually working toward that. Our treasurer, Wayne Boyd, has asked me to get the 400 top bills and which communities they come from, because they're trying to help them with a program to weatherize their homes. And then we are looking at co-oping our biggest utility company, which is Cherry Todd, and works mainly with our central portion. Thank you. It's Bobby Davis from Wisconsin.
Thank you. So I'm Bobby Davis. I'm from Wisconsin. So I'll go ahead and talk about our program as well. I'll make this pretty fast because we only have like 9 minutes. So in Wisconsin, we have a similar policy that Colorado has with reinstating LEAP applications. What that does is allows individuals throughout the program year, if they've been denied for the program, they can go ahead, redo the application as the date of the application was originally started. We also have a report that we created that the local agency can go ahead and pull and then review the application, see if it was what the reason it was denied for, and then reprocess that application any time of the program year. So that's that. And then we have a couple system enhancements, which one is called the Master Customer Index, which is the MCI database, which is administered through the state of Wisconsin Department of Health and Services. What that database does, it goes ahead and verifies the customer's name, date of birth, and their social security number. And if it's not verified, it will get sent to SSA, and then it'll be returned to us within 3 business days. It also gives us the information if an individual has passed away, and it will mark that individual in our system as deceased. And it will include the date of death as well. And then the second enhancement that we have is the Wisconsin Energy Fuel Information, which we call WEFI. So that operates as a web service call. An intake worker inputs the data of the customer's name and the vendor into our database. And then we click a button, it runs the information, and then it provides us the annual and monthly cost, the annual and monthly consumption, the disconnection status, account open date, account type if it's residential business, and then the bill dates and cycles, the current balance, and the degree days. So it gives us all that information, and then the worker can go ahead and assess the situation of that household at that time. And then in Wisconsin, we require all intake workers throughout the whole state of Wisconsin that is processing applications to complete WEAP Basic and WEAP 2.0, which is an online training database, and it's virtually, so that an individual can do it at their own pace. And that allows staff to go ahead and understand the Wisconsin Home Energy Assistance Program. It gives them navigation through our database, which we call the Home Energy Plus database, and then gives them the application process start to finish. And then it also goes ahead and gives basic information on crisis assistance for Wisconsin and the program services, which is the furnace repair replacement program in Wisconsin as well. At the end of each WEAP Basic, WEAP 2.0, there is a final exam that goes ahead and individuals can complete, but they do have to complete it at an 80% successful rate in order for them to be able to get permission into our Home Energy Plus database. So then WEAP 2.0 goes ahead and goes into more in-depth regarding the program services, weatherization, crisis assistance, the eligibility criteria, the financial eligibility criteria, and then more in depth on how to process an application through the HE Plus system. And then at the end of that one as well, there's a final exam that the individual will go ahead and take as well. Throughout each one of them, though, there is checkpoints for individuals to go ahead and test their knowledge of what has been provided to them throughout the curriculum. And we've actually been requested to add more quizzes throughout the curriculum just so that it can go ahead and check their knowledge, and they felt that it stuck more. And then we also go ahead, we have a training, the Home Energy Plus Training and Technical Assistance website, which gives individuals resources, WEAP benefits, the HE Plus program overview, WEAP intake methods, the navigation and process. We do have demos in there as well, so individuals can watch and perform the duties at the same time. Application management, all the notifications that go to customers, vendors, and then any documentation that we require through the state of Wisconsin. And then it also goes ahead and provides more detailed information on crisis assistance, program services, and weatherization. I went pretty fast and I apologize. But does anybody have questions?
We have 2 questions about the LIHEAP system. Who designed it, the state or the utilities?
The state of Wisconsin did. With collaboration.
And are all utility companies participating?
Our Class A utilities, so all our investor-owned utilities are participating in the WIFI.
And do the utilities enter the customer's information based on individual customers' requests or state workers?
Customers' requests. So as we do the application, it's entered into the system.
One question about the training. Do you do classroom training too, or just online?
We do one annual training event every year in February, but most of our stuff is online. But we do have like a refresher at the beginning of the program year, like an update session to go ahead and provide individuals updates for that next program year. Awesome.
So I'm going to take a moderator's opportunity. The next thing is lunch, and there's some really good questions I think Kevin has. We're going to take 5 extra minutes, so we're going to go right till 11:50. And Kevin, I think we have a couple of questions that the panel might be interested in hearing, answering for people.
We do. Melissa has one slide.
Oops. Oh, one final slide? Okay.
One after that.
Oh, and so Melissa is saying there are many different approaches to improving client service and empowering staff. Technological, rule changes, staff training, client education, hands-on assistance, and many solutions are mutually beneficial to both clients and staff. What? And ninjas. What? Oh, and ninjas. So again, what you've heard, just the basics from 4 very experienced program managers. Our idea was to let them tell you what they have been able, what they've been doing. If you want more details, they will be happy to be contacted and get information and give you more information on how that is done. Okay, Kevin, some questions.
Okay, we have one for Brian, and I think this also applies to Teresa. Bobby, with these high-tech options, do you ever get pushback from applicants who are not well versed in technology? And do you help them apply using Compass? And also,
Here, let me do this. All right, so in Pennsylvania, Compass is not the only way that people can apply in Pennsylvania. We do have paper applications available in all of our county assistance offices. We also post a fillable PDF version on our website so that it can be downloaded and printed out, so we will do it that way. But we also do have a Compass helpline that's on the platform, so if somebody is having any sort of technical difficulties, whether it's actually a systematic issue or like a client error, customer error while trying to use the system, they can call that number and get the assistance they need to fill it in. But we do take paper as well.
In Wisconsin, we have an online resource guide for the customer. So the customer can watch this video and then fill out the application as they're going through the application process.
And in Colorado, we have all the alternatives that Brian had just mentioned. Plus, we have a heat help call center, and they actually take applications for people over the telephone that have barriers that can't apply in the other traditional means.
Another question, why is the application process so complicated? Why can't we simply serve people with a flat rate versus all the calculations? And the short answer to that question is come to LIHEAP 102, which is all about.
Good point, Kevin. Thank you.
Okay. Does Assurance 8 prohibit prioritizing vulnerable households before non-vulnerable? I.e. specific intake for elderly, disabled, and children under 6 before accepting applications from those without homes.
encourage prioritize benefits by those vulnerable populations, as does outreach. So the equitable treatment and assurance aid is related to renters and owners, and those who are categorically eligible versus income eligible. But you can and are encouraged to give priority to those vulnerable populations.
One final question. What benchmark ideas can you share to enhance the customer experience?
Do any of you actually do customer surveys or customer feedback of any type? And track that over time?
We don't actually do the customer survey, although you don't, but we do have what we call the Family Voice Council. And it is comprised of members who are on or have been on some sort of assistance plan of LEAP, like SNAP, so that we do presentations to them. They give us feedback on barriers, that sort of thing that they have seen or witnessed.
This is a big soapbox issue of mine. So if any of you out there have ideas for engaging your clients, either getting their feedback or involving them in building those benchmarks, I would really love to talk to you. Okay, but I will tell you that only happens at the local level.
The only time,
Go ahead.
the only time the Roseman gets any type of feedback is through our weather station. We have them fill out a customer survey or response.
Okay, moderator's prerogative. I'm going to tell you about a survey we did in Oregon, and I'm going to compliment the Oregon intake workers. We did a survey with Oregon clients, and we asked them, and we were particularly, because we did special oversamples of people of color and people who speak different languages. And one of the questions we asked was, before you applied for LIHEAP, were you anxious about how you would be treated? And of course, the people, racial and ethnic minorities, were at a higher rate of being anxious about how they would be treated. But then we asked them, how did you feel after your experience with the intake workers? And those households had a higher rate of satisfaction than households who are not minorities or not a racial and ethnic minority. And so we thought that it was a great statement about the intake workers in Oregon, that they reached, they met people where they were, and the people felt very satisfied with their experiences. With that, I'm going to close the session. Please remember to fill out your session evaluation. And thank you very much for coming. And if you want to know more about benefits, come back to the